A very spry, sage old lady was once asked, "What is the key to good health and longevity?" Without hesitation, she said, "Healthy teeth and healthy feet." So today, we're speaking about oral health with someone who knows all about the importance of healthy teeth. Dr. Fong, the dentist and founder who's leading Smile Design Ottawa. Come and see what I'm talking about. As soon as you walk through the door, you feel so welcome. The space is bright, airy, and everyone is so friendly. Thank you for taking the time to chat.
It's my pleasure.
Yes, about the importance of oral health.
Good oral health, you're a happy person. You don't have aches and pains. You feel confident, improve your self-esteem. And that's the very easily feelable benefit from it, right? But scientifically, on and on, all the time, all the study shows good oral health links to the overall general health. In fact, the bacteria that cause endocarditis, heart disease, by and large, bacteria come from the mouth.
Mm-hmm.
So people who are immunocompromised or people who have other medical illnesses, those are even more important to get their dental health up to par.
Mm-hmm.
So this is why oral health is always important.
Yes, and when you say getting your oral health up to par, how often should one come in? And what does that look like, getting your oral health up to par?
Well, that is a very, very generalized questions. A lot of patients that I have met in my whole career, they always make a self-diagnosis or self-fulfilling notion that, hey, people will tell me, I went to cleaning last year. I went to cleaning 2 years, 3 years ago, and I brushed my teeth really well.
Yes.
So
That's true.
and they all think I take care of myself very well, dentally, orally, right? But in fact, it's not true. Many cases, there are many dental oral diseases, especially gum disease. They started very silently. You don't know it. Okay, you cannot make a diagnosis. You don't know you have it. And then, if you don't go regularly and seeing a regular dentist, no one would pick that up. No one would make that diagnosis and tell you that you do have problem. So that start some treatment now for prevention, for that dental problem getting much worse. I'm not talking about just gum disease, I'm talking about just cavity. On and off, I see patients that hasn't come for a while, or new patients. Wow, you do that, because you can say it, but it's sadly that if I've seen that patient a year, even 6 months, or sometimes earlier, I would have prevented so many big problems, that cavity would be a lot smaller. I would be able to just fill the cavity. Now you have pain, you have dental infection and abscess. You're talking about, root canal situation. You're talking about much more elaborate, and expensive treatment too. So that's why, people need to go to see a dentist regularly.
Yes, and regularly, like say every 6 months, you should. It's about
That's
prevention.
the general
I'm
term.
assuming, right?
It's the general term.
So
preventions.
It's about prevention.
It's about preventions, yeah.
And everyone knows the importance of brushing and of course flossing. So not everybody flosses though.
No.
So when it comes to brushing your teeth, how often does one do that? And flossing, is how important is it to be flossing regularly? And what does regularly mean?
Wow, everybody knows you need to brush. A majority people would say, I don't have time to floss, I floss once or twice a week. That's the answer you get, right? There's no way around. I haven't come across a study, that saying that this is the strict formula you follow and then you'll be very good, dentally. Why? Is because we are all different. Mm-hmm. Every person is different. If you have crowded teeth, it's different. Your age group is different. In a sense, different in what? The way you take care of your teeth. How often you brush. How important is that flossing for you, right? Now, on a younger person, a teenager, they don't have no gum disease because a triangle black hole space, or the food doesn't go between teeth. So sometimes they get away from not brushing or not flossing all the time. Whereas for older individuals, when they already have some gum loss and bone loss, and they eat, a lot of food goes in between. So if you don't floss, you just brush, that's not good enough, right? So therefore, every person genetically, diet, the pH in your mouth, everything is different. How you tip the balance, the scale, that disease will start if you don't do this whole bunch of cleaning effort. If you some people who are diabetic, you need to brush 2-3 times a day. You need to floss every day, and then you already had bone loss, basically come from gum disease. You need to brush and floss between teeth, right? So to straightly, simple answer your question is everybody at least need to brush no less than once a day, 2-3 times a day would be nice. Okay, and flossing your teeth at least once a day. That would be very generalized speaking.
Okay.
Okay.
And when we talk about flossing or brushing, so when is the best time to brush? Let's say some people they brush at night only once a day, and then they floss at night once a day. But myself, as soon as I get up in the morning, I have to brush my teeth.
Yes.
But not everybody does that.
Yes.
They're saying, I'm going to eat my breakfast. Why do I even need to brush my teeth in the morning?
Okay.
So is there a general rule around that?
Well, again, there's no fixed rule. Right? It's all individualized. So if you only brush once a day, I would say do a good brushing before you go to bed. The reason is a lot of people don't know that when you fell asleep, when you sleep through the night, your saliva flow slows down. Your mouth is the most anaerobic and dry during those long periods. In fact, that's the most damage to your teeth. From the residual bacteria, from the plaque, from the germs, right? So if you floss your teeth, brush your teeth really well before you go to bed, that would be the best one-time only brushing that you need to do. If you only do one time a day, Ideally, I like to see people, assuming everybody not snacking all day, you have a lunch, you have a supper, brush your teeth after each meal.
So you do brush your teeth after each meal, ideally?
Because you want to prevent food from getting in between teeth. Right?
Okay.
Yeah. That left behind from having a meal, that stuck between, and that's the number one reason a lot of adults end up with cavity. That's because that's not the self-cleansing spot of your mouth, because your teeth are not lined up, your teeth have some, produce filling or whatnot reason, you have gum disease. Food always go there, a piece of meat always gets stuck behind. If you don't brush and floss or clean, after each meal, that's how you get up and out with the cavity right there.
Okay. And brushing after each meal, but you don't have to floss after each meal, but brushing, that's the very least as you should be brushing.
So that's more ideal.
Ideally.
If you want absolutely the best for yourself, brush in the early morning, and then a quick brush after each meal.
After each meal, right. But then before you go to bed, you brush and floss.
Floss.
Right. Yeah. For me, I brush, I floss, and then I use my mouthwash.
Well, that's fine.
And what do you think about mouthwash?
The most accessible tool for cleaning. Everything's under the umbrella of cleaning. Right? You walk in the pharmacy, there's so many tools. There's floss shredder and you can buy the electric one, electric toothbrush and electric flosser. Everything is different tools to help you to clean, right? And in fact, there's not, some study shows, there's electric toothbrush or this design of the head, it cleans better, more efficient in that sense for cleaning. But most importantly is your brain. Diligently, if the toothbrush, whether it's handheld, whether it's electric, if you don't brush the surface, you don't touch the surface, it won't clean.
Right, yes.
Right? You know, now if you have lots of open space, you know, you put the floss through, and then you don't take the time to use the floss properly to clean both sides of the surface. It doesn't do a very good job, you know. So even picking up a piece of floss, you have to think about how to use that floss. It's a tool. Right? So sometimes, you know, older people with more space, more periodontists, they said, don't floss. Just buy the little brush to brush between teeth. It's called flossy-brush. It's a different tool. It's almost like a little tiny tube, rounded, you know, different diameter, small little toothbrush. It's like a toothpick. You use it and you clean. It's the same effect. You poke it through the teeth, you know, which is harder for a very young adult because the space is so tight. There's no bone loss and no gum loss. Food doesn't go in easy, so they use a piece of floss. For a lot of general adult, especially senior, you use the brush instead of the floss. It's easier to play with it too because of dexterity reason. You know, you're holding a thin rod, a handle, and easy to poke it through teeth, right? So all these things is very individualized.
Right.
You know, I always say, you know, go to see the dentist, go to see somebody, get a checkup to see if where your teeth, your whole oral health, where it stands, whether you have any disease. You know, what's the professional recommendation? How to, moving forward, how to prevent what? Prevent diseases. You know, what kind of diseases? How to prevent bone disease, gum disease, cavity is a disease, right? So we want to prevent all that. So,
we're talking about brushings and toothbrushes. So is it, some people they swear by the electric toothbrush. I prefer the manual ones. So what's your preference?
I use both.
Okay.
In fact, you know, it's just what's comfortable in your hands. I find electric toothbrush, the brush that they had sometimes smaller, or now they make them like a regular toothbrush shape. But you know, the smaller one, you have to be a little bit more careful because they spin at 200-300 RPM.
Yes.
So you don't want to stay on one spot too long, or because the head is so small, if you don't touch the surface, you don't clean that part of the teeth.
Yes.
Right? So the small, in some way, is good to reach the difficult area, the back molar, the backside, close by the tongue. Wonderful. But you have to get there to clean that surface. You know, the last molars on the bottom, beside the tongue. A lot of people miss that area, right? The electric toothbrush with a small head, you slide it in. Wonderful, right? So they all have goods and bads, and see how you use it, how understanding you use it. You know, sometimes people don't give much thought when they brush teeth. You know, they look very sloppy. You know, 30 seconds and done, right? Oh, everything feels good. Why do they feel good? They feel clean. It's because the toothpaste put all the flavor, all the paint, and all that. You think they feel, oh, my teeth are spotless, you know, refreshed, nice and clean, but it's not, you know. How many people would buy the, we call disclosing tablets? That's one of the oldest methods, you know, to show it's a little, they use vegetable dye, you know, fruit dye, you know, and you chew on it after you brush your teeth, and, you know, you go to school and you have all the kids do that in front of the thing and spit out, and then you look, wow, everything stained red. Red stained part is actually the germs and the bacteria, and you know when you miss brushing. So just teach yourself how effective you brush in your mouth, whether you're paying attention, whether you have crowded teeth, whether you're moving your toothbrush from surface to surface, one tooth to the next, you know, and not missing any spots, right? So people sometimes, it's also always our job and duty, you know, as hygienists and dentists. Hey, it needs several times. I noticed this part is, you know, build up a lot more plaque, thicker plaque, and a lot more, you know, calculus before, you know, the tartar, you know. So let some professional tell you where you're missing too.
Yes, exactly. And sometimes with toothbrushes, some people use like a hard bristle, soft bristle. What's the best type of toothbrush to get if we're getting
I
one?
always propose or recommend a softer toothbrush.
Okay.
The problem with a harder toothbrush is the harder toothbrush can actually remove a little bit more the more harder and calcified tartar, in combination with a lot of toothpaste. But then the negative side of that is if you aggressively or overzealously brushing with a hard toothbrush, you can push the gum away, damage the attachment, right? So, when on this subject, I always tell all my patients, don't use a lot of toothpaste. Toothpaste inside has pumice, has all the fine grit powder, like a scouring powder. If you use a lot of toothpaste, it feels very clean, there's no questions. But at the same time, incidentally, you're wearing down your enamel surface, you're wearing down your teeth, because you're brushing your teeth all your life. You're not talking about months, talking about years, all your life. So we see more damages, accidental collateral damages to teeth from people brushing too hard. The most cardinal problem is a lot of people can feel it. They take the fingernail, they touch it along the gum line, they feel a groove, they feel a trough, they feel, hey, something digging in. That's the softest part of the teeth. They call the CEJ, the segmental enamel junction, where the enamel layer finish along the gum. The enamel is harder material, but it's so thin, up to the gum, down. No more enamel to protect. And then when you brush too hard, that's how you wear down that cementum, that root part of your teeth, and you get a groove. That's not from cavity causing that. That's from main reason. There's other reason too. If you brush your teeth, if you find chewing gum all day, you get that too, combination. But by and large, it's come from a lot of toothpaste, heavy brushing with the hard toothbrush. So all my career, I tell people, use a soft toothbrush.
Yes.
Just a pea-sized toothpaste.
Okay.
The important part is you brush your teeth regularly. Regularly means 2 times or 3 times a day without missing. Because if you do that, the plaque hasn't built up very thick and they come off easy. Whereas people, today I'm too tired, I work overtime, I didn't brush. So you save up yourself. I only brush consistently. One day you're missing, one day you don't. Then your plaque become thicker, and then little soft toothbrush doesn't feel clean because your plaque is that thick, right? So, but if you do it, no matter how tired you are, you never miss that brushing habit 2 times a day or 3 times a day.
Thank you. And so what would be your advice to our viewers in terms of maintaining good oral health over the long term?
You do your homework, brushing your teeth diligently, religiously, if I use the word, 2-3 times a day, flossing at least once a day, and you must see the professional. Even myself, after a few months, I sit down in the chair. I have all the mirrors, all the tools, and you build up tartar. The lower front teeth behind, you can see it yourself without a mouth mirror. You can open it in front of the mirror, you can see it. I brush my teeth, but they still build up. In fact, the other area is the upper back molar where the saliva come out from the saliva duct. They build up a lot of tartar. So it's the tartar that you don't clean away. You cannot possibly 100% clean away from brushing. That's why you need professional cleaning. I sometimes don't know how to make people understand that. It's like you buy a car, you need oil change. You cannot just don't change oil. You need to see a dentist for that cleaning, and it's so important to on top of what you do at home. That's very important. I don't downplay that, because we don't follow you home and do it for you, right? You have to do it yourself. But once or twice a year, go see somebody, go to a dentist, establish a good relationship and ask them, where you stand, how the overall, your dentition, your mouth, what kind of shape, is it in good health, good shape? Get the recommendation how to move forward in the future. Do I need to come in, 3 times a day, a few times a year, or twice a year, or do I have ongoing, existing, active problem, disease, gum disease, cavity, and so on and so forth, right?
And I'm assuming it's about preventing it even at a very young age, right? So what age would you recommend someone start coming in to see the dentist?
Well, different age group of patients have different kind of, potential teeth problem, right? So, very young age from 3 to 5 all the way to the teenager, they get cavity easily too. Primary teeth catch cavity easily. Do you need to fix it? Absolutely, because you don't fix cavity on baby teeth, they get infection, abscess, and pain, and so on. And they run out the baby teeth and they're losing space, affecting the eruption sequence, affecting the adult dentition. So, from very young age, they need to come in.
Yes.
Okay? And build up that habit, build up that knowledge that taking care of your own teeth, set of teeth is important. It's a lifetime of commitment, lifetime of knowledge, slowly build up. It's a matter of building a relationship.
It is about building a relationship, you're right.
It's no different than any other profession, isn't it? If you're a hairdresser, if you met somebody, even, you know for a long time, you build up that trust. Your fear level, your fear, everything come down, right? You can trust somebody, it's trust.
Yeah, exactly. And I'm sure a lot of our viewers are wondering if you're taking patients.
I know this guy. Technically, professionally, we don't select patient, we don't choose patient, right? Doesn't, to me, is as long as you're in my chair, I do my very best to help you, right? It's nothing to do with, race, age, or you know what I mean, right? So, yes, we always take the patients, But these days, I don't know if you know that in our profession we are in great shortage of hygienists. So I had that problem the last couple of years, but now it kind of stayed. I finally found someone at Tropiqua, someone that has a lot of experience with the same aptitude with my, principle of practicing. So you have to be, if you come here, you have to be a little bit flexible on the hygiene schedule. You're a little bit behind, so you don't possibly, get a cleaning next week or even, the exact day and time that you like, right? So,
Yes.
So if you're a little bit more flexible, you're always welcome.
So you just have to be patient.
Yeah.
But it's worth the wait.
Oh, wow.
Well, thank you very much,
Hey,
Dr. Fong. It's been a pleasure.
I
So prevention
have-
is key.
Yeah, prevention's key. Prevention.
So thank you, and thank you all for watching.
Let's take time for moving.
Remember to like, comment, share, subscribe. Thanks for tuning in.